Hello, Sonia. I'm Dr. Whitfield. How can I help you today?
I've been getting really bad stomach pains and heartburn.
Sure, and does that get better or worse after eating?
Oh, much worse. And I burp a bit and I feel like I have this sour taste in my mouth, and then sometimes I vomit a bit into my mouth as well.
Right, and is there anything else? Any bloating, abdominal pain or nausea?
Yeah, all of that. It's really hard to live with and it's been getting worse.
And how long has this been going on for?
About 6 months now.
Okay, cool. And what's your lifestyle like? Are you stressed? Is there any other issues going on?
Well, I'm a third year medical science student, so I've got quite a bit of work, especially for pharmacology. I've just been finding it really difficult and stressful, and I've had exams just a couple of weeks ago. They were really hard. And then managing it all with my job and all the hours, yeah, I suppose I'm a bit stressed.
Sure, and what's your diet like? Do you smoke or drink a lot?
Well, I don't smoke, but I think I should eat less. Like, I eat a lot, especially at night, and I have a few drinks as well. My friends always tell me I should eat slower.
Okay, well, this does sound like you have some sort of reflux. It may be due to a few things. Firstly, it could just be a simple gastroesophageal reflux disorder, which is easily treatable with lifestyle changes and some medication. However, it may be a sign of a peptic ulcer, in which case I should give you a referral to see a gastroenterologist, who may think it's best to perform an endoscopy to see what's going on in your stomach.
Well, I don't think it's that serious, and I'm not really keen on taking any medications. What are my options?
Well, before I do anything, you need to start eating a balanced diet and stick to eating at the same time every day. And I know it sounds basic, but you need to chew your food as much as possible. Try and slow down a bit when you eat. I'm to prescribe you with just a month's prescription of a proton pump inhibitor, such as omeprazole, just to help calm down everything in your stomach while you fix your diet.
Okay, are there any side effects of proton pump inhibitors? I thought people usually used antacids.
Proton pump inhibitors, or PPIs for short, are the newest and most effective treatment. Like all drugs, there are some side effects, like cold symptoms, nausea, vomiting, headache. But I will give you the smallest dose of 20 milligrams a day, so there shouldn't be too many problematic side effects. Antacids are a good short-term solution, such as when reflux occurs occasionally, like after eating a spicy meal. I do think proton pump inhibitors are overprescribed. However, in your case, having had these symptoms for over 6 months, omeprazole is appropriate.
What if I have to keep taking them? Surely there'll be adverse effects.
I think changing your diet and a month's prescription should suffice. In terms of adverse effects, they've only been shown to affect people who take a much larger dose and for over 7 years. This includes possible potassium and calcium ion malabsorption and an increased risk for pneumonia. But these studies only involve patients with a renal impairment, the immunocompromised, or the elderly, so it's nothing for you to worry about.
Okay, well, it sounds safe. Out of interest and for my medical science degree, can you explain to me how it works?
Yeah, sure thing. So, the stomach contains acid to break down food. In your case, the acid builds up and is causing irritation that is experienced as heartburn or reflux. The inner surfaces of the stomach consist of numerous gastric pits that secrete acid. The cells lining the gastric pit are mucous neck cells, which secrete mucus, the G cells, which produce gastrin, and the parietal cells, which secrete hydrochloric acid. Okay, let's zoom in on a parietal cell. The proton pump present in parietal cells is responsible for acid secretion. The proton pump is located on the luminal side of parietal cell. Potassium leaks out of the parietal cells. The proton pump actively transports protons into the stomach lumen and potassium back to the parietal cell with hydrolysis of ATP. Proton pump inhibitors reduce acid secretion of the stomach by binding irreversibly to the proton pump, which prevents the active transport of protons, dramatically decreasing the acid content of the stomach.
That was really informative. Thanks for your help.
Sure thing. Before you go, I must emphasize that fixing your diet is your number one priority. The omeprazole will work very well, but is not a long-term solution. Come back and see me in a month and we'll see how things are going.